Okay, so thanks for coming to the HESI review. So the HESI, as we talked about all term, is going to have lots of different questions that are going to um, require you to pull your knowledge from your other classes as well. Because as we've talked about, community nursing, caring for clients in the community involves med-surg, it involves peds, it involves geri, maternity, fundamentals. Okay, the HESI, as your exams have been, is clinically focused, right? Client scenarios. How are you going to care for clients in the community? So it will require med-surg knowledge, pediatric knowledge, geriatric knowledge. And that's why you can see from your HESI and the information that you are asked to research, it involves a variety of different concepts. It requires it involves a variety of different populations. It involves taking care of clients throughout the entire lifespan. Right? There are questions about infants. There are questions on the HESI review. There's pediatric topics. There's infant topics. There's adolescent topics, adult topics, elderly topics. So as we talked about from week 1 on, this HESI pulls together everything, pulls together all the concepts we have covered in class over the last 9 weeks, right? My suggestion is that you use this HESI prep. Hopefully you spent some time on it and did some proper research, but your HESI prep is your primary study guide for your HESI. Okay, and you need to think of each topic that you researched from a clinical judgment point of view. You've learned the knowledge, now you have to put it into practice. And by putting it into practice, that means caring for clients in the community with whatever the topic was, whether it was teaching, whether it was visits, home visits, whether it was being able to assess a client coming into your facility, whether we've talked about community nursing is about numerous different settings, right? Can be the home setting, can be a hospice setting, can be rehab, assisted living, long-term care, dialysis centers, urgent cares, office buildings. These are all places where community nursing care is provided. Okay, so if you start to look at, I just pulled up a random HESI prep, okay? But if you start to look at, so let's think about it. Let's just start with anthrax, okay? If the topic that they're asking about is anthrax incubation, what kind of clinical judgment question might you get? What is the incubation period? What are you looking for? Right? What are signs and symptoms of anthrax? Remember, the directions in this
I have
asked
a
you,
question.
excuse me?
I have a question.
Uh-huh.
So when you said, all right, so we're talking about anthrax, and you said what would be a clinical judgment. So with clinical judgment, like what exactly do you mean by clinical judgment? Like what would be seen in anthrax? Like,
Clinical judgment means that you're taking care of a client and you're using your knowledge to put it into practice. So if you have researched what anthrax is, all the way from assessment to evaluation, what might you look for in an assessment of a potential anthrax exposure? What are you looking
oh,
for?
okay, so that's
What
what
might,
you basically mean about that.
pardon me?
So like since you worded it that way,
Hmm.
um, that's like that's what you're looking for. Like we need to look for that and like when we're answering the question.
Yeah, they're going to be clinical. judgment questions. So
Okay.
the expectation is that you have the knowledge about anthrax. Okay, that you have the knowledge about disasters. Okay, what's a level 1? What's a level 2? What's a level 3? I mean, you've already done all your research. Your HESI study guide is complete. You've done the research. Now you need to think about clinical judgment, meaning if you are caring for a population that was experiencing a level 1 disaster, a level 2, or a level 3, what is going to be your role? Okay. Red triage is another topic that's been asked about. What does red triage mean? Okay, so you've identified what red triage means. Now, how do you care for a client who may be tagged with a red tag during triage? Does that make sense? These are clinical judgments. This is assuming you are taking care of a client with whatever topic it is. It might be teaching. It might be caring for a client, providing med surge, wound care. It may be an elder doing a diet assessment. Okay, these are all clinically focused. You guys do CJ Sims in your other classes, right? Yes?
Yes.
No?
Yes, ma'am.
What are CJ Sims about?
Usually about whatever we're on in the chapter.
Okay,
They
no,
they take a
what?
patient and go. Oh, I'm sorry. Go ahead.
No. What does CJ stand for?
Um,
Simulation?
I knew
Clinical
it.
judgment.
Judgment. Okay, thank you.
Clinical judgment, that's what I'm talking about. So clinical judgment is your patient scenarios that you work through during your CJ Sims, correct? That's why I say at the very beginning of the term, even though we don't have CJ Sims in this class, practice. You have access to all different kinds of CJ Sims, right? One student told me in the past who did quite well on the HESI that she went in and since she has a library, you all have access to all different adult health CJ Sims, right? But she went in and kept practicing scenarios. She kept going in and doing extra NCLEX questions on adult health because we talked about early on in the term that this class, your exams, your HESI, brings all your previous knowledge into community, right? In order to be able to care for clients in the community, you do need your med-surg skills. If you're working with the elderly, you do need your geriatric skills. If you're working in the peds community, you do need your pediatric experience and knowledge and fundamentals. So this brings it all together. This community HESI is there's a lot of med surge on it, a lot of different age groups. Okay. So be thinking CJ Sim, clinical judgment simulation. Okay, if you're in a disaster, what's communication look like in the community? What are the responsibilities? Why do we have mass casualty drills? To look at community responses, what can be done better? There's the topic that's covered on the HESI is natural disaster preparedness. As a community nurse, what do you think you should do? How are you going to prepare the community? These are simple, straightforward topics that are asked about in the HESI. Like I said, you've done the legwork. Okay, completing your HESI prep. Use that as your primary study guide. If you would like, go back to your 3 exam study guides and also go back to your quiz rationales, your 5 quiz rationales. There isn't any topics on the HESI that we haven't covered in class. I take that back. We covered the concepts. However, like if I get to, where's our health promotion teaching? There's some research that I didn't cover every single topic because they're covered in other classes, right? So I wanted to, for example, obesity. What class was that covered in for you?
Message 2.
Okay. What about lipid screening? When did you talk about lipid screening? Med surge?
one
Message
of them
2.
Yeah, med surge.
Yeah. We covered conjunctivitis in, I believe, week
With
2,
pediatrics.
right?
Yeah, we've covered conjunctivitis in a few classes,
Yeah,
actually.
exactly.
Eczema with
You've covered
pediatrics.
eczema in a few classes, lead poisoning you've covered, and we covered that
Right.
as well. Okay, so these topics limit heart healthy diet. Okay, so this particular student talked about dietary recommendations. This would be a teaching question, right? Clinical judgment. You are teaching about heart healthy diets with a particular population. What are the recommendations? What is the patient? What are the teaching bullets that you want to make sure you convey to the client? Elder health assessment. Okay, we did a whole topic. We did a whole concept on elders. Okay, if you're working with elders in the community, what kinds of things are you going to assess for? So
One thing I've noticed about,
go ahead.
excuse me, Professor. Yeah, one thing I've noticed about community is it's like heavily on prevention in the community.
Right. We try to focus on primary prevention strategies in the community. And it would be nice if we could focus most of our time on that, but we do focus some time. But we're also focused on secondary in the community, which is screening for risk of all different kinds of things. And in community nursing, we're all also practicing tertiary interventions, right? When we're taking care of clients with chronic illnesses, when we're taking care of kids in schools that have diagnoses, medical diagnoses, mental health diagnoses. So it's a combination of all three. Yes, would it be wonderful to be able to focus all our time on primary prevention to try and keep a community healthy? Of course, but that's not reality, right? Think of clinical judgment with vision screening in the preschool. Why is it necessary? Because we're trying to identify risk, right? Trying to identify risk at a young age. That's clinical judgment, right? So you're taking your knowledge and putting it into practice. That's what your CJ Sims, it stands for clinical judgment. Okay. And you've noticed on all three of your exams, the questions are focused on client scenarios, are they not? They are. Okay, so this is just an extension of it. The HESI, it's bringing all the tools that you have learned in community throughout this term. It's pulling from all your different classes because in week 1 we talk about why is this class placed at the end of your program? Because you need all that knowledge to be able to care for community clients. Right? It's not that you're doing anything differently. You're simply providing care in a different environment. Your med-surg skills are going to be the same, whether you're doing wound care in an acute care setting or wound care in the home setting. Right? Your abuse and violence, your mandatory reporting is going to apply to the acute care setting and the community setting. So you already have all the tools, you already have all the classes. Last week we covered complex chronic illnesses. Well, you're going to be caring for complex clients with complex chronic illnesses in an acute care setting. They eventually go home. Then we care for them in the community, whether it be in a rehab facility, assisted living, home. Right? So you've already done the legwork. Your HESI prep is your legwork. As you're reviewing it, be thinking of clinical judgment questions. Think back to your CJ Sims. Once you read the scenario of your CJ Sim, what questions did you get asked? Maybe what were the vital signs? Right? What were the labs? What was the testing? You're given a scenario of information so that you can make a competent clinical judgment decision. That's what the HESI is about. Okay, I know it was a long assignment. I get it. If you started it early on, like I asked you to in week 1 and worked on it throughout the term, you're going to get out of it what you put into it. If you rushed and did it at the end, you're probably going to have more studying to do. But if you process this all term, and if we didn't cover the specific topic, I know I covered the concept, but if we didn't cover the specific topic, that's because it was provided in a different class. So that's what I mean by pulling it all together. Does that make sense? So again, you've done it. I mean, you've done what you need to do to prepare. Now you need to review your HESI prep. And as you go through each box, be thinking, what would be a clinical judgment question? What would be, this patient needs teaching. This patient needs medical intervention. This patient needs screening. This vulnerable population, what are the risks? Right? And based on the risks of the homeless population, how do we care for them? So I don't want you to get too anxious about the HESI. Everything you're going to see in the HESI has been covered. Right? So if you've been coming to class, doing well on your exams, and if you haven't done well in your exams, you've reached out for tutoring with me and we've gone through what you were struggling with and did some tutoring. If you've looked at the weekly concepts and you've been engaged in class, you've heard all the information. You will be fine. And I think I've told you guys, when I do my week 12 kind of end of term assessment, one of the questions I ask my students, and I'll be asking you in week 12, how was the HESI prep? Did it help you prepare for your HESI? I get an overwhelming, astounding, or astonishing yes. I'm so glad I did it because it did prepare me. Remember, each box on there represents some kind of a question about that topic. I don't know what the questions are. I don't build the HESIs like I build the exams. HESI comes like your NCLEX from a big bank, but I can see the topics covered. That's why I put the topics on your HESI prep. So it's most likely you're going to get a question about anthrax incubation. You're going to get a question about lipid screening. Okay, I can't identify the questions, but if you think I'm taking care of a client that needs a lipid, is going to have some blood work and have a lipid screen. Okay, why? What might be going on with the patient clinically that they need a lipid screen? Make sense? I know there was something in there. Let's see. Something about a lot of this section on teaching. Where was it? Okay. Health promotion and teaching is a whole section on that. And sometimes you don't think of teaching or screening as clinical judgment, but it is clinical judgment. Right? In this home health section, There's a lot of med surge in this home health section. Right, home care. Why do we provide home care? NG tube feedings. Now, of course, I didn't cover NG tube feedings in the home. That was covered in med surge. What you go into the home and are doing an assessment of a client who has an NG tube. What are you looking for? Is the tube functioning properly? Are they getting the proper nutrition? Are they gaining weight? Right? How does the skin look around where the tube is inserted? You got to think clinical judgment outside the acute care setting. This clinical judgment applies in the community setting. Right, so let's take my example, my history of school nursing. I was performing clinical judgment every time a kid walked into the clinic. Right? Oh, they seem to be a little bit short of breath. Oh, they have an inhaler. Oh, we need to give them their inhaler. Right? Oh, the student ate some peanuts. They're allergic to peanuts. Oh, they might need their EpiPen. Right? Based on my assessment. Make sense? So NG tube feedings, respite care, we talked about that. Falling. Clinical judgment question about falling might be what? You go into the
Are there
home.
any rugs, any throw rugs in the home?
Exactly. You go into the home and do a risk of safety assessment, a risk fall assessment. What are you looking for? What's good that's in place? What's risky that's in place? Right? Looks like they're going to ask something about elderly home nutrition. Well, what does that look like? You go into the home and you're doing a home nutrition assessment. What kinds of things are you going to look for or ask? Right? Suspected abuse in the home, reporting abuse. Well, we know that we're mandatory reporters, right? Below the knee amputation, home care assessment. What are we going to be looking for? Well, this student gave some information on wound care, right? How does the wound look? Right? What do we want to make sure they're washing the leg and incision every day, assessing the entire leg? Are there any sores, blisters, red marks? Right? Think ADPI. COPD. Let's say you're working with a COPD patient in the home and you want to make sure the ADLs are being met. What do you want to talk to the patient about? Are you pacing yourself? Are you planning ahead? Are you positioning yourself upright? Prioritizing your activities? How do they look? What's their color? How are they breathing? Are they using their oxygen if they need it? So does that make sense? How would you take care of a client, or how would you teach a client, or how would you screen a client using your assessment, intervent plans, goals, assessment, evaluation? How would you use your ADPI? You're not going to be surprised with any information. You have the topics and you've researched the topics. So, does that help? Darlene, does that help?
Yeah, that helps.
I was listening to Dr. Ford today, and she was talking about level 1, level 2 of disaster. And I was surprised that what I wrote in my HESI prep was not what she said. She was talking about level 1 as a mild disaster, and level 2 is like you can prepare and have the population move, and level 3 is the worst, where you have to move everybody out of their town. But in my med surg book, I was trying to look at it as preparedness and the nurse in action, and third phase was the recovery.
Okay. What were you listening to?
Professor Ford.
Right. What? Her exam 3? What were you listening to?
No,
Under?
the HESI review, the one she
Oh.
had recently.
Oh, did you go to that?
I didn't go, but I was registered to her YouTube channel, and I get the
Oh,
chance to.
I'm waiting for her to send that to me so I can post it in my
I
sections.
subscribe to her YouTube channel, and whenever I get
Oh,
whenever she posts, I receive a
okay.
notification.
So did she review level 1, level 2, level 3?
Yes, she did.
May
Oh.
I interject? I think, okay, so the level 1, level 2, level 3 phases. I think there is a level 1 type of disaster, a level 2 type of disaster, and a level 3 type. And then the phases are in every disaster, whether it's level 1, level 2, or level 3. So the phase is the, the recovery and all of that. Those are phases. But the type of disaster is how severe the actual disaster is.
Exactly. But in the book, in the MedSurg book, in chapter 44, I couldn't find those, level 1 is a mild, level 2 is like medium, and level 3 is the highest one where you have to prepare for transportation for a whole city and get them moved. But me, I was thinking about those phase, because to me, level means phase. See what I mean?
I understand. Yeah.
Uh,
Hang on.
Yeah, I was
I'm
kind of
gonna
under
get
it.
my
I
book
thought
and
that
come with
level 1 was the math.
Hang on.
I'm gonna get my book and come real quick.
I'm pulling it up now. Chapter 44. Okay, there's your tags. Okay. Triage tags.
Is this an announcement?
Nope,
Or
I'm in your
this
I'm in your MedSurg book
Oh,
in chapter 44. Darlene, where are you referring to?
When you go on page 1029,
1029.
hospital preparedness,
Uh-huh.
and on the next page, what if I put? The response phase.
Okay. I'm
On page 1036.
36.
And for response, I put on 1037, I put nursing management in the reconstruction stage. But listening to Professor Ford, this is not what it is. It's the level 1 is a mild disaster.
Where are you seeing that?
I don't see it. But when I was listening today from Dr. when
I
she
wonder,
meant,
I wonder if she was speaking about the phases like Barbara just said. About the,
Janet.
or Janet, sorry,
yeah.
Janet, sorry.
Okay, and question,
Then
what's
after, then after she talked about the triage, which
Uh-huh.
is class one, red tag, how would you treat the
Yep,
patient?
yep.
Yeah, but the level we were all questioning ourselves regarding this. Then we end
Well,
up
I don't want you to do that. I'm just reading through this real quick to see if I can get,
question, where can we find the phases if that's not what they are?
I'm looking to see if it is in here. I know that I think maybe what she was talking about is the triage system. Okay, there's your triage. Okay. What about in your, have you covered disasters in any of your other classes?
yes, and med surge.
Oh, you have covered in med surge. And what
Yes,
did you cover? Pardon me?
that was recently doing last
Okay.
week.
Okay. And did you cover the levels?
We don't see any levels in the book that says level. Besides this class,
Okay.
we have phases and disaster triage system, which has the classes, class 1, 2,
Yeah.
3,
Yeah.
4, and
Um, okay, so this is the closest to our levels. Okay. Class 1, 2, and 3. Okay. So this would be your level 1, your level 2, your level 3. Okay.
okay.
So I guess I could word that better in the HESI prep, and instead of here in the book, it says classes instead of levels. Right?
Okay.
Okay. Darlene, does that answer your question?
Yes, thank you, ma'am.
Yeah, you're welcome. You're welcome. Okay. Does anybody have any other questions? Like I said, you've done the legwork.
Yes, I'm sorry, Professor. When I went in to register for my HESIs,
Uh-huh.
I didn't see community there at all. I registered for my mental health, but I didn't see community listed at
Make
all.
sure you're in the right cohort.
Okay.
You got to be in the right cohort, otherwise you're not going to see it.
Okay.
And if you are in the right cohort and you don't see it, you got to reach out to campus.
Okay.
Okay, I don't have anything to do with the scheduling. What I do is try and give you a heads up of when it's going to be. But all the scheduling is done through campus. The first thing I would check is cohort. That is usually what's going on.
All right.
That
Thank
you
you.
have tried to sign up in the wrong cohort. If that doesn't work, you've got to reach out to campus. Janet, you're from Port St. Lucie.
Yes.
You test on Tuesday.
Okay.
Yeah, so you got to get this figured out.
Okay. Yes,
It's
ma'am.
too late tonight, but
Right.
yeah, but you don't test till
Definitely
Tuesday.
Monday. I have to be there Monday anyway for
Yeah.
my other one, so I'll ask about it
Try
then.
and double check your cohort when you're signing up. That could be the issue. Okay.
Okay. Thank you. Mhm.
You're welcome. Does anybody have any other questions? Has this been helpful? Okay. All right.
Professor
Well, best
Martel,
yes.
I'm sorry to bother you again.
You're not
About the
bothering me.
communication,
Pardon me?
about communication during disaster.
What
Can you
about
go
it?
over that topic again, please?
Say that again, Darlene.
How about communication during a disaster?
Uh-huh. What about it?
Okay,
No, I said let's
135. Hold on.
Oh, I think you were starting to talk about it and stopped.
oh, okay. Where's my oh. Okay. What about okay, so let's just talk about it. I've lost my HESI prep that I pulled up to review. What about communication and disaster? Why is it important?
Um,
Why do we have communication and disaster? Why do we have drills?
so we have drills to test the level of efficiency of the response teams. And
See how everybody works together. Right? When an actual disaster happens, what do you see?
Is it the mass casualty?
If a disaster happens, what you see is a central place for communication. Right? We do drills to see how prepared we are, how collaborative all the agencies that need to respond are. So just think about it in terms of, let's say your community had an impending hurricane coming. What would you expect the communication to be in your community with regarding a disaster? What would you expect the preparation? People who live in hurricane-prone places, I'm sure they have public service announcements. I'm sure they're informed about how to prepare. I mean, just think about it. What communication would be required, let's say, in the preparedness stage? Let's take a step back. What communication would be required in drills? What communication would be required to get the community prepared? And then what actually is the communication when the disaster hits? Right?
Okay.
Does that answer your question, Darlene?
Yes, ma'am.
Okay, all right. Any other questions? Again, you've already been preparing yourself all term for this. Just think clinical judgment, CJ Sim. Okay. Best of luck to everybody here on their HESI. Make sure you're signed up for one. Your community. I sent an announcement earlier today. Make sure you're signed up. Okay. You'll be fine. You'll be fine. The fact that you're here is excellent news. Okay. So I will get Professor Ford's recording from Tuesday, get that posted tonight, hopefully tonight. I've got to proctor some more exams this evening, but either tonight or tomorrow morning, I'll get my recording posted. And then I just recently sent an announcement that Professor Kershaw has changed her HESI review from Sunday to Saturday evening, but that's in your announcements. Okay. All right. Well, thank you very much for the time and the effort coming. I appreciate it.
Okay,
I hope
thank
everybody
you.
has a good weekend.
Thanks.
thank you,
Tomorrow at
Professor.
All right.
7?
Pardon me?
Thank you, Professor.
You're
Tomorrow
welcome,
at
Barb.
7?
I'm sorry, Darlene.
Tomorrow at 7 for
I think I
Professor.
put it in the announcement. I think it's tomorrow at 7. I believe it's tomorrow at 7. Yeah, it's in the announcement.
Thank you. Have a good
Okay.
evening.
All right. Bye.
Bye.
Bye-bye.